I'm a third generation family physician, but I grew up training in visual art, mostly figure drawing, portraiture. And in med school, I sought media reflecting my experience in training, working directly on old X-ray view boxes, like this piece featuring reproductions of woodcut panels from Gustave Doré's illustrations of Dante's Divine Comedy. And then this piece, which I made in residency during COVID, trying to capture the experience of the profoundly isolated patients I was encountering in nursing homes when every day seemed backlit by the coronavirus. So I associated the work of art and the work of medicine long before choosing medicine as my vocation. Growing up, my dad, who's also a family doctor, would come home with the covers of JAMA, the Journal of the American Medical Association, lovingly torn out to give to me. JAMA was famous at the time for this iconic cover art. It was curated by the very gifted eye of Therese Southgate, who was herself an art historian and a physician. And she wrote that the work of medicine and the work of art share a fundamental connection because they are both, quote, acts of long and loving attention. So you can imagine my disappointment when in 2013, which is the year I started medical school, it's the year that burnout began to raise its head in a new way among the medical community. It's the year the majority of physicians would no longer recommend medicine as a career to their children. It's the same year Dr. Southgate died. That JAMA replaced their cover art with the soul-nourishing image of a table of contents. So readers were quite clear in early press releases. They wanted more efficient access to content. The artwork was getting in the way of the real work. So in some ways, I've been trying to bring the work of beauty back to the work of medicine ever since, and not through forcing artwork back onto the covers of medical journals. Rather, I'm utterly convinced that a deeper magic is at work when we talk about beauty in medicine. Beauty disrupts the control of our table of contents, and it beckons us to something more. As philosopher Elaine Scarry writes in her wonderful book on beauty and being just, quote, when we come upon beautiful things, they act like small tears in the surface of the world that pull us through to some vaster space. So if you're pre-med and you're interested in medicine, or interested in medicine regardless, you might be familiar with this painting by Sir Luke Fields. It's arguably the most iconic portrayal of the physician's kind of steadfast attention to the suffering other and the patient. I saw this and was just enchanted by it as a medical student. But my experience actually in training was a bit more disenchanted. So I wondered, how would Fields portray a clinician in our time? So I imagined this. A pale figure in an empty space, bent over a computer and a clipboard, burnt out and depressed, far from the patient. But I also sensed that beauty still lingered in the background. So I used gold leaf to resist the lack of color and brute sterility, gilded windows connecting two souls across the dark frame between them. And indeed, the frames and windows we use matter. In 1984, the environmental psychologist Roger Ulrich reviewed the medical records of patients recovering from surgery in a suburban hospital in Pennsylvania. And their team found that patients who had a window to a view to a tree healed on average a day faster, with less need for pain medication, less post-surgical complications than patients who had only a view to a brick wall or had no window at all. That's bizarre, right? And it says a lot that when patients are alone or in recovery, they need more than the right meds. They may need something like beauty. So a lot of what I do as a family physician is care for folks with mental health needs. I'm often the first clinician a patient is sharing their anxieties or trauma with. And much of my time is spent in something like talk therapy, on-ramping patients to great counselors or to psychiatrists like Dr. Kinghorn when the occasion calls for it. I've encountered patients with abuse, depression, addiction, who have themselves encountered something beautiful that played a mysterious role in their healing, far more than all the medical doctors they'd seen prior. And I've experienced the same myself. I remember in particular when I was beginning my 4th year of medical school, I just returned from a year of study at Duke as a theology, medicine, and culture fellow with a renewed sense of purpose and joy. My wife and I had just welcomed our first son into the world. We have 3 boys. I was ready to engage medicine anew. And yet our firstborn brought difficulties I didn't anticipate. My grandfather died just before I was to graduate. He was the first physician in our family doc, just like myself and my dad. The church my wife and I had helped plant was imploding before our eyes. It was kind of like watching a divorce. I didn't match the specialty I wanted to. So all these layers of identity and community and relationship kind of falling apart in some sense around me. I would leave my wife for weeks at a time to interview while she's alone with our newborn. So the days were long and difficult and dark and lonely. And I tell this story because my heart and my intellect were brimming full, right? Like I was just about to receive my MD. I had all this extra theological and philosophical training. I felt utterly equipped in some sense to have lots of pretty good things to say, to answer towards questions of suffering. But when it came to my own spirit and my own interior life, I did not want more arguments. I did not want more books or more right things to think. I just wanted something beautiful. So I would rise early in the morning, light a candle, and often sit before that candle or before an icon or a poem or a prayer and just sit before this beautiful thing. I was, in the words of Henry Nouwen, quote, too tired to read the gospel, too restless to have spiritual thoughts, too depressed to find words for God, or too exhausted to do anything. But I could still look at these images so intimately connected with the experience of love. And in some ways, I think this connection between art, beauty, and mental health comes down to love. I don't seek beauty because it is philosophically interesting or equips me with cute or clever things to say in an art museum or a Veritas forum. I hide beautiful things in my heart because I need reminding that my table of contents is incomplete and I cannot control my life as much as I think I might. That I'm known and loved as a child of God, and that my patients need to know that they are known and loved too. So I think talking about art and beauty is a delight. I love it. This is a gift. And at the same time, I'm just a family doctor. And what I see as a family doctor is an unprecedented season of despair and loneliness and sadness and malaise and worry. I see it in my patients almost daily. And all this talk of beauty and art is not about manifesting the right spiritual thoughts to think or words to say. Rather, I think it's learning to recognize wounds and wonder at the same time. It raises the fundamental questions that we long for and hope for. And that is an interesting place to begin thinking about mental health. So I'll close with this. This is my account of this altarpiece by Matthias Grunewald. Imagine you're a patient in a hospital. You have wounds that will not heal. They fester, they smell, your family's abandoned you, your friends do not come visit you. And every day you look up at this image of a tortured Galilean whose body seems to twist and writhe on 2 pieces of wood. This may have been the experience of patients who looked up from their beds in the monastery at St. Anthony in Eisenheim, which specialized in hospital work for plague victims, which was a population particularly prone to despair. The great artist Gerard Richter, who is himself an atheist, said that, quote, art is our greatest hope, which is a statement he made, interestingly, in front of this altarpiece. So here's this great figure of art pointing over his shoulder to an artwork featuring someone else pointing over their shoulder. Richter points to art as our greatest hope. John the Baptist points to Christ crucified. As a Christian, I see in Christ's wounded flesh patients encountering beauty, not through what is pretty or bright or useful, but through small tears that mirror their own, small tears in this one who pulls me through to some pastor.